In a move that has ignited considerable debate within the global health community, plans have surfaced for an American-only Ebola quarantine center to be established in Kenya. This proposal, still in its early stages, has quickly drawn a chorus of criticism from experts across various fields. The mere concept of an exclusive facility, dedicated solely to citizens of one nation yet situated on foreign soil, immediately raises complex questions about ethics, equity, and the very nature of international cooperation in a health crisis. It's a vision that many find deeply troubling. The core of the controversy lies in the center's explicit American-only designation. While nations often provide care for their own citizens abroad, the establishment of a dedicated, high-security quarantine facility exclusively for one nationality in a host country is largely unprecedented. Situated in Kenya, a nation that has historically grappled with its own public health challenges and has a complex relationship with international aid, this plan carries significant weight. Experts are scrutinizing the implications of such a facility, questioning its role within the broader framework of global health initiatives. From epidemiologists to human rights advocates, a diverse array of experts has voiced strong criticism. Public health specialists warn that such a segregated approach could undermine the principles of global health equity, creating a two-tiered system for disease response. Ethicists, meanwhile, question the morality of prioritizing one nationality's health security over the collective well-being, particularly when the host country itself faces health threats. The consensus among these critics is that a pandemic response must be universal, collaborative, and inclusive, not exclusive or nationalistic in its focus. At the heart of the ethical debate is the concept of distributive justice in a global health crisis. If a dangerous pathogen like Ebola respects no borders, should our response be limited by nationality? Critics argue that establishing an American-only facility in a region where local populations remain vulnerable sends a deeply problematic message. It suggests that some lives are inherently more valuable or deserving of high-level protection than others. This approach risks fueling resentment and hindering genuine international solidarity, which is vital for effective disease containment and prevention efforts worldwide. Beyond immediate ethical concerns, many perceive this plan as carrying distinct echoes of a colonial past. The idea of a powerful Western nation establishing an extraterritorial, exclusive zone within an African country for its own citizens, particularly in the context of disease, invokes troubling historical precedents. It can be seen as undermining Kenya's sovereignty and agency, despite any agreements made. This perception of unequal power dynamics risks breeding resentment, fostering mistrust, and complicating future diplomatic and public health cooperation efforts, essential for any lasting solution to global health threats. From a practical standpoint, experts highlight a myriad of challenges. How will such a facility integrate with Kenya's existing healthcare infrastructure without draining local resources or talent? What protocols will govern interactions with local communities, staff, and supply chains? There are also significant security implications and questions of legal jurisdiction. The isolated nature of an American-only center could create logistical nightmares and operational inefficiencies, potentially making it less effective in a real-world emergency than a collaboratively developed, fully integrated facility that leverages local expertise and resources. Perhaps one of the most significant costs of this proposed center is the potential erosion of trust. Public health initiatives rely heavily on community engagement and trust. If local Kenyans perceive this facility as an exclusive enclave designed to protect foreigners while offering no direct benefit or even posing a risk to them, it could severely damage public confidence in both American aid and broader international health interventions. Such mistrust complicates vaccination campaigns, disease surveillance, and emergency responses, ultimately making everyone less safe during a widespread health crisis. Instead of segregation, experts universally advocate for stronger international collaboration. They argue that resources would be far better spent on strengthening local public health infrastructure, training Kenyan healthcare workers, and establishing truly global, inclusive rapid response teams. Facilities that serve all in need, regardless of nationality, and are integrated within the host country's system, are seen as the gold standard. This approach not only provides equitable care but also builds sustainable capacity, empowering nations to combat future outbreaks independently and collectively. The stark reality of global health crises demands a coordinated approach. Ebola, for instance, has demonstrated its capacity for rapid spread and devastating impact, highlighting the urgent need for robust, accessible quarantine and treatment facilities globally. The focus should be on creating universal health security, not isolating one group. Experts emphasize that building resilient health systems, providing equitable access to diagnostics and therapies, and fostering transparent information sharing are paramount. These are the investments that truly safeguard populations worldwide, reflecting a shared responsibility for global well-being. Beyond the immediate context, experts warn that this American-only plan could set a dangerous precedent. If one powerful nation can establish an exclusive medical facility on foreign soil, what stops others from doing the same? This approach could lead to a fragmentation of global health efforts, where each nation retreats into its own shell, hindering the collective action critically needed to tackle pandemics. The perception of such a center globally could undermine trust in international aid more broadly, making future coordinated responses to shared threats increasingly difficult. The criticism surrounding the proposed American-only Ebola quarantine center in Kenya serves as a crucial reminder. Global health challenges are inherently interconnected, demanding solutions rooted in cooperation, equity, and mutual respect. As the world faces an ever-present threat of emerging infectious diseases, the pathway to true security lies not in isolation or exclusivity, but in strengthening universal health systems and fostering genuine partnerships. Experts urge a re-evaluation of this plan, advocating instead for initiatives that truly embody the spirit of global solidarity in health.